Hi, I'm Dr. Weng. Not long ago, I posted a before and after photo of a young man and an improved jawline. This area in younger patients can be a very complex area to address. Sometimes doctors will call it a deep neck lift or deep neck contouring. The reason being is when we have fullness in the chin area, under and in our neck, there can be many different causes. Let's talk about the anatomy here. Going from the skin deeper, there are many layers that can and may need to be addressed. On the skin surface, beneath the skin, there is the subcutaneous fat layer. This is the area that oftentimes is addressed with liposuction or even energy-assisted liposuction. Beneath that is the platysma muscle. It's a sheet of muscle that goes from the jaw down to the clavicle and should connect in the middle. Sometimes there can be gaps in this muscle that need to be stitched, and sometimes this muscle may be stitched to tighten and suspend the tissues underneath it. Then deeper to the platysma muscle is another layer of fat called the subplatysmal fat. This is an area that cannot be addressed with liposuction and needs to be removed or cauterized to shrink it down, and this can only be done if you open the platysma to see it. Beneath that, there are muscles called the digastric muscles and the submandibular salivary glands or submaxillary salivary glands. Sometimes these muscles and glands can be fuller and larger than normal, and reducing them can also help with the contour of the jawline. What is it that they say when you have a hammer and everything looks like a nail? It's important as a surgeon working on this area that you don't treat it this way. Everybody's anatomy is different, and addressing the appropriate cause of the fullness will give us the best result. Another way to improve the jawline is to add a chin implant. Oftentimes patients who have fullness under their jaw also have a weaker jaw and chin, and adding an implant to extend the jawline can really help the aesthetic. Something I've noticed in addition with patients who do have a weaker jaw or a smaller jaw is that this allows for less room for all of those structures we were talking about. And when there's less room, they're more likely to descend and fall and hang in a place where they're more visible. Not to mention, can also, with the crowding in that area, lead to sleep apnea. But that will be a story for another day. All right, that's it for today.